We're one of 100 divisions across Australia whose principal role is to support general practice in applying health aspects to their local communities. The most principal barrier has been resources. Even though there's been a great cooperation between the division and the Aboriginal community, we just haven't had the resources to really identify what the need is, to actually go out and look at what the problems are, what are the strategies to get people in place. But now with the Closing the Gap funding, we think we can make a real difference in that process.
The vision mainly is to improve the health of our people in the community. There's a lot of chronic diseases around, and we've had a lot of losses in the community. So I think the people themselves know that it's important to work with them, the people that will provide a better health service for them.
And the first stage for us is to be able to get the workforce together. And I guess the main impact is at the moment we now have 3 and possibly 5 in the next month Aboriginal people working in Aboriginal health. So the transition of being able to use Aboriginal people known in the community, from the community, supporting their community is the first impact we're going to have on that. Hopefully that will translate into being able to have Aboriginal people then feeling much more comfortable and much more aware of the responsibility they have in supporting their health outcomes.
Well, for me, community is the priority. So upskilling the community, empowering, building confidence, to better self-manage, for everyone to have an Aboriginal health check, children, adults, to get them done regularly so that there's screening and early intervention or early detection, education. That's my priority. But for practices, to give them the tools as well so that they're confident in asking the question, are you Aboriginal or Torres Strait Islander, and being able to help to increase their access as well.
We're very fortunate when we appointed Karen as our project officer that she had been working in the local community with local government. We've now been able to bring on Emma, who is a local Noongar lady, and Karen and Emma have come together as a team, and I think just the respect they have in the community, the fact that they've been able to bridge us Wadjulas with the Noongar community has been terrific in being able to say this is a true partnership. So we're very fortunate and very pleased to have both of them on board.
Working with the division here has been absolutely awesome. I've never worked with such a great group of people, but working with Karen, the project officer, has been really, really good. I think that because we're both Aboriginal and coming into an organisation where they haven't had Aboriginal people before, we're able to support each other, and we're really on the same wavelength and have the same priorities, so we work really well together.
Kwinana and Rockingham, we had a lot of elders and community members come forward, and we established our local district Aboriginal Health Action Group from those members. The Rockingham Kwinana Division of General Practice, we're very close, and they've certainly met all the standards that we've put up for them so far.
Certainly General Practice are willing, ready and wanting to understand more about being able to be supportive of Aboriginal people. And if our Aboriginal people can feel comfortable going into a practice, can feel comfortable that the health they've been giving is first class, I think this will go a long way to changing the way our health statistics are here in the future.